Hello and welcome to the Peace and Nutrition podcast, Dr. Lara Bryden. Thank you so much for coming on the podcast today. I'm excited to delve into today's discussion, which is on the topic of the menstrual cycle. So we'll be talking all about periods and ovulation, everything women should and need to know. This is a topic I truly believe is important and should definitely be spoken about a lot more, and it certainly is now, thanks to you and other experts and advocates. So there's a lot to talk about when it comes to our cycle. So we obviously won't be covering everything, but before we get into addressing the female cycle and answering some of those frequently asked questions, can you briefly cover the hormones women need to be aware of and that are involved in the cycle?
Okay, yeah, so kind of a period cycle 101 overview. Well, the two main hormones we make are estrogen and progesterone. And we make estrogen in the first part of the cycle leading up to ovulation. Ovulation is the main event of the menstrual cycle. We should speak about that today. And then after ovulation, we make progesterone, which is the hormone we need to keep our periods from being too heavy or too painful or too difficult in some way. And then so ovulation is not just the release, it's the release of an egg, which you would need to make a baby, but it's not just for making a baby. Obviously, ovulation is how we make the hormones we need to be healthy, including estrogen and progesterone. And then there are various hormones that can interfere with ovulation that might be important in our conversation today. There are hormones like insulin and testosterone and thyroid. Those all have an impact on how easily we can ovulate and have regular cycles.
Yep, exactly. So as you said, we'll be covering these hormones as we go through the discussion. So very often women, when you're growing up, you're not really aware of the importance of a healthy and regular cycle. So growing up, I too just thought a period was just about having babies, but having a healthy cycle and period is more than that. So you published a post on your blog called "If You're Not Thinking About Ovulation, You're Not Thinking About Your Health." And this post was an open letter to every clinician, personal trainer like myself, and blogger who offers health advice without taking into consideration and thinking about periods. So apart from, why are periods important? Why is ovulating so important?
Yeah, why is regular ovulation important? Two things. One, it's our monthly report card, so it's a good indicator that everything is okay with health, including that it's the right diet, that you're getting enough to eat, because it's quite easy to lose your period or stop ovulating from under-eating carbohydrates, which that was kind of one of the main points of that post. My open letter is basically this, to being the necessity to make sure that your female clients are eating enough to keep menstruating. So the ovulation being the monthly report card is the first reason that it's important. The second reason that it's important is what I said earlier. It's how we make the hormones that we need to be healthy. And just to be clear, so some examples of how estrogen and progesterone are important for general health. Estrogen, if you knew this, but it's anabolic. So it helps to build muscle mass. It improves insulin sensitivity. It's good for the gut microbiome. It improves intestinal integrity, so reduces intestinal permeability or leaky gut. That's just some of the things that estrogen does. And progesterone is really important for healthy immune function. It can help to prevent autoimmune disease. It's good for the brain. It can help with sleep and mood and bone health. Actually, both hormones are really important for the long-term health of bones, which is one of the reasons why women who don't ovulate, whether it's because they're not having periods or because they're on the pill or hormonal birth control that suppresses ovulation, women in that situation have reduced bone density compared to women who cycle naturally. So that's a very clear example of why naturally cycling and ovulation is important for health.
And I think a lot of women aren't aware of these, like for bone health, having a regular cycle. And it's just sad because, like you said, women are so chronically under eating and over exercising, and it's really important that they are aware of these long-term health risks and benefits of of ovulating and having a regular cycle. And it's not just about, losing weight and being able to see your abs, because, had a post once saying abs are cool, but so are healthy hormones. So
yeah, exactly. Hormones are better.
Yeah, exactly. So it's definitely really important. So we are constantly receiving signs from our body through our symptoms that, sometimes things aren't right. So this can be seen in our periods. So our periods are always telling us, when things are going well. It's a report card on, when things are not going so well. So what should women be looking out for? What are some of the signs of a healthy cycle, and when things might be going wrong, how can you assess? What should we looking for?
Yeah, so the parameters of a healthy cycle is that the period comes anywhere between every 21 to 35 days if you're adults, let's say every 45 days if you're a teenager or early 20s. And that's counting from day one of the bleed to day one of the bleed. So that defines a healthy cycle. That's usually, if you have a cycle that is of that length, that's a good sign that ovulation is occurring, which is what's important. The other parameters is that the bleed itself shouldn't be more than 7 days. And you should not lose more than about 80 milliliters of menstrual fluids. So that equates to, 4 or 5 tablespoons over all the days of the cycle, which is actually not very much. It looks like quite a lot when it's in the cup, or the menstrual cup, or the tampon, but it shouldn't. If you really add it up, and in my book, Period Repair Manual, I talk about ways to quantify how much menstrual fluid you're losing. And the other parameter is that the period should arrive basically symptom-free, like relatively symptom-free. So no strong mood symptoms or headaches or cravings or breast tenderness or anything like that, and no strong pain.
Mm-hmm.
It's pretty common to have a little bit of period pain, but actually pain is never normal, and severe pain is never normal. So anyone with debilitating period pain needs to be alert to the fact that it could be something like endometriosis, which I talk about in my book.
Exactly, because I think there's this whole thing where when you're on your period, pain is normal. Like we grow up thinking we should be going through this pain, when, like you said, a little bit of pain is fair enough. Like blood is coming out of our bodies. It's somewhat normal. You can experience some kind of pain, but when you're in severe pain, that can be the reason of a chronic condition or endometriosis or something. So, and like you said, if you're suffering with too much blood loss, what is the possible cause for that? So what might be causing heavy blood flow?
Okay, yeah, let's talk about that. And I will just say, first of all, actually, most women should get to the point where they have no pain at all with periods. That's what my patients just experience. So that's the benchmark for what periods can be like for many of us. In answer to your question of what could be some underlying reasons for heavy periods, yeah, I have a blog post called How to Treat Heavy Periods with Diet and Natural Progesterone. So in that blog post, I talk about a few of the underlying reasons. One, just to rule out, is a problem with thyroid. So underactive thyroid can cause heavy periods. So usually most doctors will screen for that, or at least they should do a thyroid test with a blood test just to make sure that's not the reason. Being low in iron can actually make periods heavier, and it becomes a vicious cycle, because then if you have heavier periods, then you become lower in iron. So iron is a very important mineral for women. We get it from red meat and eggs, but we do need to sometimes take iron, which can be quite helpful. Other reasons for heavy periods, there can be, actually not that uncommon. It can be have something called a coagulation disorder, or like a blood clotting disorder, which the doctor should rule that out. These are things for the doctor to take a look at. In my book, I have a section called How to Speak to Your Doctor, and I have some questions where you can ask the doctor, I have these heavy periods. Has thyroid been ruled out? Has a coagulation disorder been ruled out? And then some of the other more common reasons is endometriosis, which we mentioned, or a similar condition called adenomyosis, which can cause heavy periods. Another reason is PCOS. So the hormonal condition PCOS, it can look like all different things. It sometimes causes no periods at all, sometimes very light periods, sometimes, which, you know, we can talk about why that is. Sometimes for some women, it can cause what look like quite irregular, quite heavy periods. And the reason that happens is because they are cycles where no ovulation has occurred. So there's no progesterone made, which is the hormone that's made after ovulation. And progesterone normally has the effect of lightening our periods. So if you're not making that, then you can have periods that are too heavy and also go on for too long. A really good marker of PCOS is bleeds that are more than 7 days. So, you know, 10 days or 2 weeks or something might happen sometimes with PCOS. So it's important when you're treating heavy periods to try to identify why they're happening and then treat the cause.
Exactly. You always have to get to the root cause. So always get the blood test, speak to your doctor, get them to ask you the exact questions and get to that root cause. So the other thing I wanted to ask while we're talking about healthy periods previously, what is a healthy period color? Because that's a very common kind of thing. People might see different colors. What's the color you should be looking for?
A lot of it depends on how quickly it's flowing. So like if you have a fairly decent flow, it's going to be brighter red. When it slows down, when it's lighter, it's going to look a little bit darker because the iron in the blood has a chance to oxidize. So, and it's normal to have clots anywhere up to about the size of what I would call it in Australia, like a 20-cent piece, or it depends on what, a coin about that big. So, and you're more likely to form clots if you're flowing heavily because the body hasn't had a chance to the natural anti-clotting agents to work. So there could be different reasons. To be honest, with my own patients, I don't worry too much about the color. Just knowing that, sort of varies depending on how quickly it's flowing. I guess the other thing is if you're anemic, again, low iron, the blood will be paler. So that's something to be alert to.
Okay, interesting. So we covered some reasons for lost or irregular periods like PCOS or undereating, overexercising. Is there any other reasons for the causes of lost or irregular periods, or are those?
Yeah, there are actually quite a few reasons. And again, so in my book, I talk about the first step is you haven't had a period for a few months and you're not sure why. Obviously, the first step is to see the doctor. So the doctor has the opportunity to rule out, there could be problems with something called prolactin. There can be, a few different reasons. And the doctor also needs to rule out pregnancy. It's worth pointing out that even if someone maybe hasn't had a period in a long time, you could become pregnant at any month because you can become pregnant without ever seeing a period. So it is worth always doing that pregnancy test just to be sure. But then at the end of the day, the lack of periods usually comes down to one of two things, which I'd like to talk about because there's quite a bit of confusion between them. So one, we mentioned undereating. That's called hypothalamic amenorrhea. And two, PCOS, which is in some ways kind of an opposite condition to hypothalamic amenorrhea or undereating, because PCOS typically is associated with insulin resistance, or might be a situation where you need to eat less sugar or less carbohydrate potentially. But the problem is that the diagnosis of PCOS is not scientific at the moment. It's not, the way it's conducted, unfortunately, a lot of the time is not very accurate. So for example, some doctors will mistakenly diagnose PCOS with an ultrasound. Say, oh, look, you have polycystic ovaries, therefore you must have this condition because you're not having periods. But here's something really important to understand. You can have hypothalamic amenorrhea or lack of periods due to undereating or undereating carbs and show polycystic ovaries on ultrasound. So that ultrasound test doesn't really mean anything. The true diagnosis of PCOS there has to be some evidence of high male hormones, and more than just, a few breakouts on the skin, a bit of acne. That's, in my view, not enough to qualify for high male hormones. There has to be some evidence on blood test or facial hair or something pretty significant. Plus, a test I use a lot, I talk about in my book and in a couple of blog posts I've written. I wrote a blog post called Maybe It's Not PCOS, where I talk about using the pituitary hormone LH, or luteinizing hormone, to try to distinguish between hypothalamic amenorrhea and PCOS. And it's quite easy to do. The doctor can help you with that, or women can look at their own results if they've had it on early in their cycle, or a few parameters. As long as you don't get a period within 2 weeks after the test, then you can use that LH reading to try to understand if you have high LH, meaning PCOS, or low LH, meaning hypothalamic amenorrhea. I'm trying to put this information out there because I've spoken to so many patients and readers who've been told they have PCOS when they don't. And at the same time, you can have PCOS and not know it because maybe your ultrasound is normal and no one has really thought to explain to you that having, a period every 3 months and a period that lasts 10 days is not normal. And that can be a sign that PCOS is happening. So I hope that helps to clarify things.
That is so true. I think that PCOS is very too much overly diagnosed, and you need to really delve deeper into the test and not just rely on the ultrasound. And personally, when I was diagnosed, I don't know if I even had PCOS, because everything was just, I just don't trust everything was done correctly. But the last time I did a blood test and ultrasound, everything came back fine. So I'm just going to say it's all good. But it's so confusing.
Well, and PCOS is reversible.
Yeah.
So it is very possible to meet the criteria at one point. Then when your health improves and you start having regular ovulation and your testosterone goes down, your LH goes down, then you sort of no longer qualify for the diagnosis, although in a situation where you did have those things really happening, there is always there's the vulnerability to it coming back if you were to ever, eat, change your diet and not eat healthy.
Yeah, exactly. You really, you can reverse it, but you need to continue with your specific diet and your lifestyle. Otherwise, those symptoms can come back. So you really need to be, consistent. But that's.
But on the other hand, I'll finish by saying if you are, for example, to your listeners, if you're low carb and you've been low carb for a while and you just can't get your period is not coming, and you're confused as to what's going on, please do at least consider the possibility that maybe it is not PCOS. Maybe it was hypothalamic amenorrhea, misdiagnosed as PCOS, in which case it's worth looking into that a little bit further. Because you might need to eat more to get your period.
Because the other thing, I think when women are diagnosed with PCOS, and it's not, it can really, affect you mentally.
Yeah.
And then that can obviously cause a whole bunch of other stuff. So I definitely think it's important that if you do have this diagnosis, that you actually do kind of have it, and not just throw a diagnosis out and label someone with this, because it can affect some women negatively.
Of course. Causes anxiety, makes you think obviously you've got something wrong with you. There's a lot of experts are concerned about this, actually, about the overdiagnosis of PCOS and the rather casual use of the label and giving that label to women.
Exactly. Yeah. So what is the average age, or when is the healthiest age to have a period? So I know I've got a lot of messages from younger girls who they don't know if they have PCOS. They haven't gone to the doctor yet, and they're just, people at school are saying I've got my period, and they get all, upset and anxious. So when's this healthy age? When should you be getting it?
The official range is anywhere between, I think, 10 and 16. So if by 16 there's nothing happening, no period, Yeah, the first step, it might not be PCOS. Like I said, it could be lots of other things. So it is definitely worth seeing the doctor at that point to try to understand why there's no period coming. Is it under eating? Is it something else? And just to say, it's important to mention at this point that don't let your doctor just put you on the pill saying, we'll just give you a period that way, because pill bleeds are not periods. So as we've said, a real period is all about ovulation. It's about what your ovaries are doing. It's about making hormones and having these cycles. The pill works by shutting down the ovaries and then inducing what is essentially just a drug withdrawal bleed, which doesn't have to be monthly, could be not at all, or every few months, or the monthly bleeding on the pill doesn't mean anything. And at best, it masks the underlying problem, which you really need to try to figure out. And at worst, it makes it worse, because by suppressing the ovaries, especially at a young age, it can make it that much harder to get the ovaries to start doing what they need to do when you eventually come off the pill. Which I see so many stories like that. I have a couple patient stories in my book like that, where a woman was given the pill quite young when she was still a teenager, and then when she came off in her 30s, ready to try to have a baby, and found that she couldn't ovulate straight away, which actually makes total sense when you think about that. You've been on a drug that suppresses ovulation. It can take a while for that to come back.
Yeah, and I think personally, when I was diagnosed with PCOS and they told me when I was 18 and they gave me the birth control pill, obviously when you're that age and you don't know what PCOS is and you're freaking out because you don't have a period, you take that and you're just like, oh, awesome, I take this drug and I'm going to get my period back. But like you said, it's not a real period. It's just a withdrawal bleed.
That
and
means
it just makes stuff a lot worse. And there's so many risk factors, and I experienced quite a few of them. But the worst one for me was the swelling of my left calf, which I thought was thrombosis. So I immediately came off it, which you should consult a doctor before you come off any drug. But at that age, I was obviously scared. So it's definitely got some really bad risk factors. And like you said, you shouldn't just go on it just because your doctor said that. Obviously, we all want to trust and believe our doctors know, what's best for us, but we shouldn't feel like we have to go on the pill and it's not going to treat a PCOS. It doesn't get to the root cause. And you really need to obviously find out your root cause before taking the pill. And
there are lots of other options. The pill is not good medicine for PCOS, even remotely. And there are lots of other things that actually work, that can help to reverse the condition rather than just mask it. Yeah.
What would be some dietary tips for regaining your period? So obviously with PCOS, there's different types of PCOS. So this will obviously, differ. If it's adrenal or insulin, sometimes carbs can change, and we're all different as well. What would be, just some of those key factors you would recommend?
Okay, this is an important part of the conversation. So in my book, Period Repair Manual, I provide a flow chart that it really need to go through to try to identify what is the best diet. So step one, is it truly PCOS? Or is it hypothalamic amenorrhea, which we've just talked about? So if it is hypothalamic amenorrhea or undereating, the best diet is just to eat more, like way more, like at least 2,500 calories a day, plus probably 200 grams of carbohydrate, starch a day, just to try to get the period back. So that's that situation. So if it's not hypothalamic amenorrhea, if it truly is PCOS, then the next step in the flow chart is to determine if you have insulin resistance. And that does not mean testing blood glucose. That means testing insulin if possible, if the doctor will do it, or at least looking for signs of insulin resistance. So insulin resistance or prediabetes or metabolic syndrome, goes by different names. It's typically associated with weight gain around the middle, kind of that apple shape. And so if that's the situation, that's even without a blood test, that's a pretty good indication that there is insulin resistance. So then, although I like to quantify it with my patients, I like to know how insulin resistant they are by measuring insulin. And then For diet, actually, I find one of the most important first things is to cut sugar. And by sugar, I mean concentrated fructose in the form of desserts, soft drinks, so ice cream, cakes, sweetened yogurts, including date balls and muesli bars and, did I say fruit juice already? And just everything dessert-like. Just stop that, at least for a few months, because I find that reverses it. That's one of the fastest ways to try to reverse insulin resistance. It can be really helpful while you're doing that to make sure you have protein 3 times a day, especially protein in the morning. Protein in the morning seems to be good for everyone, and particularly good for reversing insulin resistance. And then obviously eating a good number of vegetables. And the next step for insulin resistance would be deciding how much starch is appropriate. I'm not a fan of a very low carb diet for women, but I think someone with definite insulin resistance does need to consider reducing carbs in the form of starch as well. So sometimes what I'll say is recommend a low carb breakfast. So a high protein, low carb breakfast with a few veggies in there, and then no snacking, then lunch and dinner, still with a focus on the protein, but maybe by dinner time you could have a little bit of some kind of starch with that, like a sweet potato or a potato, just to help with sleep and the gut microbiome. So that would be for insulin resistance. And then, the other types. So in my book, I talk about basically 4 or 5 types of PCOS based on the underlying driver, whether it's insulin resistance or post-pill or inflammation, or as you say, adrenal PCOS. I guess the next one to talk about is, the post-pill PCOS is really just about kind of a waiting game, having more time off the pill. I talk about a couple of herbal medicines that can help to restore periods post-pill. I wouldn't say there's any specific dietary recommendations for that, apart from just healthy eating. The inflammatory PCOS is if there's signs of a food sensitivity, like gluten or dairy, typically are the ones, or potentially other sensitivity, with the idea that those food sensitivities are generating inflammation that's interfering with ovarian function and therefore regular ovulation. So in those situations, one of the most important dietary changes is to remove those food sensitivities. So that needs to be assessed on an individual basis. And then adrenal PCOS is actually quite interesting. It's a totally different condition, even though it still gets called PCOS. It's actually a situation of having excess male hormones from the adrenal glands, not the ovaries. And the treatment is for adrenal glands. So I talk about in the book, so B vitamins and magnesium and some of the herbal medicines that can help to regulate what's called the HPA, or hypothalamic pituitary adrenal axis. That can help, that can help to lower adrenal androgens, combined with maybe one of the natural anti-androgen supplements that I discussed. That's more the strategy. I think for diet for adrenal PCOS, it's just about eating in a way that keeps blood sugar stable, so that you don't have unstable blood sugar worsening stress. So that would be just having, again, I think I'm a fan of 3 regular meals per day, 3 solid meals, no snacking. Just that's how most of my patients eat. Sometimes I do a little bit more intermittent fasting, like maybe finish eating by 7 o'clock and don't start in the morning until 9 a.m., something like that. That would be a 14-hour overnight fast. That can be helpful especially for the insulin resistant type of PCOS.
That's personally what I do as well. I do that kind of, not the specific, as people do intermittent fasting where, the traditional one, but I would stop eating at 7 and eat at 9 a.m. And I think that definitely just really helps. At least while you're sleeping, you're getting quite a big chunk of your fasting window done. So if you just eat a little bit earlier, rather than eating dinner at 9 p.m. or 10 p.m. like people tend to do and then just go to bed, you just eat a little bit earlier, and then, you've done intermittent fasting, you've got the benefits, and it doesn't feel so overwhelming. So it's definitely an easier way.
Exactly. Yeah. And it has big beneficial outcome on health. It's just that simple change of not eating in the evening.
Yeah, exactly. And you mentioned when it comes to hypothalamic amenorrhea that you should obviously eat more food and eat a lot more carbs. And this is something that when I was trying to regain my period, I had to eat so much more food. And I know a lot of our listeners and just young girls or women just really fear eating more food and eating more carbs because they think carbs equal fat, and eating too much fat is going to make you fat. What piece of advice would you give to these women? Because the thing that for me that hit me was I really wanted to get my period back for the health reasons, so I kind of put that in my mind. That's kind of what I tell people, but what would be your kind of advice?
Well, here's something to consider. Yes, if you need to eat more to ovulate and get your period, then it's totally worth doing from every perspective, because both estrogen and progesterone are are important for maintaining a healthy body weight. So this is what I say to my patients. So yes, I mean, eating more potentially could cause a little bit of healthy weight gain. That's normal. It actually doesn't. Most of my patients don't gain as much as they think they're going to.
Exactly.
They just kind of come back up a little bit more to normal.
Mm-hmm.
Then when they start ovulating, that's the reward, right? Then your female hormones kick in and they have a natural slimming effect. So there's this kind of finish line. If you can get to ovulation, then you find everything is just so much easier. You don't have to micromanage your weight with eating all the time. You can just eat more consistently, normally, feeling satisfied, and your female hormones will do a lot of the work for maintaining a healthy body weight.
So everything kind of just normalizes after you get your period. Everything, your body's clever. It just kind of sorts itself out. And with obviously our body, we keep saying this, we have this set point where our body feels safe. So you need to reach that specific weight where your body feels comfortable, and then you regain your period. And what I came to discover is that if someone went through an eating disorder like I did, just so many random things I've overcome, but it was like you really need to reach that weight that you were before you lost your period, and literally just eat 2,000 and above calories. And obviously if you're coming back from an eating disorder, you're not really focusing on the caloric content, which is why you should just eat as much as you can throughout the day. And even if you're not really hungry, just kind of eat the food just to know that you're getting enough of the caloric quantity that you require. So it's definitely can be a struggle if you're coming back from an eating disorder, but like you mentioned, it's just for healthy, overall well-being.
Yeah, well, and that's important to mention. So if there's been an eating disorder, which is extremely common, as you know, it's important, I think in most cases, to have a counselor on board or someone to kind of coach you through that and support you. And and just know that even if you're not counting calories, it's about feeling like you deserve to be satisfied with food, eating enough, eating to feel good. And one thing that's worth mentioning is that includes having a digestion that's healthy enough to eat enough. So one of the things that I run into with a lot of my patients is they potentially might want to eat more, but they reach a limit as to how much they can eat because of digestive bloating or discomfort, and will sort of unintentionally eat less because of that. So if that's happening as well, then often an important thing can be to do some treatment for digestion so that they can naturally feel hungry. I say to my patients, it's normal to feel hungry. It's actually a sign of health to feel hungry and want a big meal. That's a good sign.
Yeah, because I think we're just kind of living in a way that we have to suppress our appetite when, feeling those hunger cues are normal, and we shouldn't be feeling guilty. For example, if you have lunch and then, 20 minutes later, you're hungry, you should eat, especially if you're overcoming this eating disorder reason why you lost your period. It's definitely just about eating when you're hungry, and, just literally just focusing on the bigger picture and the most important thing, which is your hormones and your health, and not focusing so much on your weight and comparing foods and saying this food's good and this food's bad. And a lot of the time, I think if you've been going through an eating disorder, it's good to also maybe just indulge in those foods you've been restricting for so long, because I think you're obviously so stressed, and saying you can't eat this produces more stress. And I think just eating foods that you keep saying are bad helps you regain your period. So
I would agree. Yeah, I certainly don't like the whole concept of clean eating, or that certain foods are clean and certain foods are bad. So I don't take that approach with my patients at all. Although the only thing I would say is if you know there are foods that upset your digestion,
sure, yeah,
it's probably not worth having too much of that, just because then it can make it harder to eat other things. But there's so many other foods that are high calorie that can be enjoyed without any digestive discomfort. Sometimes with my patients who are struggling to eat more, I will just make the point that you almost can't afford to eat low-calorie food. So I might say eat fewer salads, instead focus on the higher calorie foods like meat and potatoes and avocado and olive oil, and obviously some steamed vegetables as well for their beneficial fiber, but focus on some of the higher calorie foods. And that it's much easier to reach the 2,000 or 2,500 calories per day by doing that.
Yeah, exactly. And the other thing I want to ask you is this, such a frequently asked question is, obviously you should cut back on the sugar if you have insulin resistance. What's the thing with fruit? Because everyone's always freaking out about fruit.
Yeah, fruit is fine. So fruit is fine. So first of all, the sugar part of it really only comes into it if you definitely have insulin resistance. So for that whole other group of women who don't have insulin resistance, or maybe recovering from hypothalamic amenorrhea, then you don't have to worry about sugar. But for the group of women who do have insulin resistance, it's about high dose fructose. That's the way I say it. So not about fructose is fine. Fructose itself is fine. The amount of fructose you get in fruit is not a problem. It's when it's a dessert, even a natural, honey or maple syrup and date balls, and what I say to my patients is, if it tastes like dessert, then it's too much sugar. If it's whole fruit, that's fine.
Awesome. Yeah, it's good to clarify that, because obviously people are always thinking fruit's bad, we need to cut that out. But
no, in my book I talk about it a little bit more precisely. Even people who have insulin resistance can probably still have about, I'm just trying to think, like 15 grams of fructose 3 times a day. So there's a threshold per meal, and I'm just talking fructose. So 15 grams of fructose is probably like a teaspoon of honey, or a couple pieces of fruit, or something like that is fine. It's only when you get way above that, by having a whole, smoothie or juice or something, that it starts to be a problem.
Sure. Glad we could clarify that.
Yeah.
And we touched on diet. Can you touch on a few lifestyle factors that you should probably do, like with regards to exercise? What, for certain types of PCOS, what would be better when you're trying to get your period back?
Well, again, it depends. If the problem has been hypothalamic amenorrhea, misdiagnosed as PCOS, then the general recommendation might be to not do too much exercise. Although I still like to think you can do the amount that you enjoy, as long as it's not, competitive athlete level exercise, in which case you really do need to get some advice about the amount of calories you'd need to try to keep up with that amount of exercise. But for PCOS, for insulin resistance PCOS, I'm sold on the idea that I think some resistance exercise, like some strength training, is probably one of the best ways. You could do it as part of a whole program, but the advantage of strength training, of improving muscle tone and muscle mass, is that increases insulin sensitivity. Muscles are great for insulin sensitivity and reversing insulin resistance. So yeah, I would say that's a big part of it.
Yeah, I definitely agree with that. I think everyone should be just, trying to build some muscle. It's just good for insulin resistance and just overall health. It's just good to have some muscle on you. So you shouldn't be, thin. And I think a lot of women are kind of coming to the fact that it's not bad, and they're trying to, you're seeing more women in the gym, and it's pretty cool. So it's good. address.
Muscle's good. Muscle's a hormonal organ as well. So it's not just for strength. It's actually for metabolism and hormonal health.
Yep, exactly. So true. Awesome. So is there anything you would like to say to kind of wrap the episode up? What's your final kind of thing you'd like to say?
Well, I do want to mention 2 supplements for PCOS, which are maybe 3 supplements, which are really superstars for this condition. And then I'll give a final message too. So the supplements, I talk about them in my book, but also on my blog. Magnesium helps to reverse insulin resistance. Zinc is really good at lowering male hormones, androgens, helping to support ovulation. And also, I'm sure your listeners have heard about inositol. It's a supplement that has been clinically trialed a few times for PCOS and outperforms almost any other medication. It's inexpensive. It's easy to take. Any brand will do. I'm a big fan of inositol. So those are just a few supplements to look at that you could do in combination with the diet and exercise. And then my final message is that it's easier than you think. Even if you've been, as we said before, it can be quite frightening, quite disheartening to be given this diagnosis. You think there's something wrong with my body. I'm never going to get there. Most women, my experience with most patients is they can reverse out of a PCOS diagnosis. Usually, sometimes it takes longer than others. And even if you don't fully reverse out of it, you can at least improve things significantly to the point where you're having regular periods. And then therefore getting the benefit of your own hormones. And to say again, having your own estrogen and progesterone kick in is good for both metabolism and body weight, but also good for reversing PCOS because progesterone itself helps to normalize how the ovaries function the next cycle and can help to reverse PCOS. So it kind of becomes a self-reinforcing. As soon as you start to ovulate, you're further and you're moving further and further away from PCOS. So I hope that helps women. I hope that's encouraging. It's certainly, you can see, and I'm sure in your community of listeners and viewers, lots of success stories of reversing PCOS.
Oh yeah, for sure. It's definitely, you have to be patient, but it certainly does happen. And from my experience, I didn't see a period for like 6 years, and I managed to get it back. So if I can get it back after 6 years, then
well done.
Get it back. But yeah, just have to be patient and consistent with your diet lifestyle, and I think everything, fingers crossed, everything will be, as you said, work out depending on your situation. But I think this episode was definitely valuable, so informative. Thank you so much for coming on. Before we wrap up, can you share how our listeners can connect with you?
Yep. My blog is larabryden.com. My book is Period Repair Manual. And all of my social media is at Lara Bryden. So I'm on Instagram, Twitter, Facebook. Yeah, love to connect with people there.
I will link everything in the show notes. Your book, your blog, everything will be there. Highly recommend that you